Well, today we're going to do some cannula liposuction of a young lady's neck. And I'm going to put some marks on here that help delineate where the excesses are, because I'm going to put a bunch of fluid in to help us do this, and it may obscure where the thicknesses are. And I draw little concentric lines, almost like a topographical map, so I know where the thicker areas are, and that line just marks for me the bottom of the bone, so I know I need to sculpt all that out. I'll make two little incisions on the bottom of the chin that are very, very small, no bigger than these little marks that I'm making. And that way we can kind of crisscross and come at this in two different planes. Get rid of this flabby look that she doesn't like. Now we're going to put just a little numbing medicine in these areas that I've marked with little blue dots, and that's where the actual holes will be made with a tiny knife blade to insert the tube in. Both the water will be placed and the fat will be extracted. Okay, you take a little pinch here. And we put this in very slowly so that it's not that uncomfortable to the patient. For some reason there's not as many nerves inside the fat, and although the needle does hurt going into the skin, once we're finished with the skin infiltration, the rest of the surgery is all done deep to the skin, but on top of the little muscle called the platysma, and that's where the fat resides. So I'm going to wait a couple minutes for this to work, and we'll be back to start. We're going to make a little tiny incision with what we call an 11 blade that has a really fine point. She's already had the local. And this incision, you can, about the size of the top of a pin. Okay, good. Now we'll take a little scissor, and we just want to establish the proper plane that we're just underneath the skin, between the skin and the fat, in the fat, and on top of the little muscle layer. Okay. This is a tumescent infiltrator. It's a little tube connected to a roller pin, and it's able to put the fluid in very fast. So this is a little uncomfortable. You okay? Mm-hmm. You can see we can pump the whole neck up in about 3 or 4 seconds. Now I'm just taking this almost like an iron and gently dissipating this fluid so that it's in there all at the same level, more homogeneous. It's not lumpy. We can better assess the extent of our liposuction. So now that she's numb, we can just put this underneath, and we're just going to kind of run it under the skin, right between the skin and the muscle. You can see that it's filling up with just a yellow material with absolutely no blood in it at all. It's amazing how profound the anesthesia can get in just a few minutes. And we're taking away all that extra so-called double chin with this little tube. And there you can see the chin's almost gone with just that little bit, and there's just this yellow material, and there's not a drop of blood in there at all. It's just fat and some of the liquid that we've put in. So we're going to empty that and then do some more. It's very thin, whereas before it was real thick. We've really thinned it out quite a bit. We've given her a nice sharp angle beneath. It's still a little thick right there. I'm going to take a little more right there in that corner. Looks great. We put one little stitch on each side that we had before. Take them out about 5 days. Mm-hmm. That way we can look at you too and make sure everything looks okay. All right. And that's the whole procedure.